Good evening, everybody. It's now 7 o'clock, so I'd like to start the meeting of the Health and Wellbeing Overview and Scrutiny Committee. I'd like to thank everyone for coming this evening, particularly as the weather's not very kind to us today. Do we have any apologies?
Yes, we do. We've had apologies from Kim James from Health Watch, Councillor Fish, Diane Sarkar and Joe Broadbent.
Thank you. Are there any other apologies? No. Okay. So if I move on to item 2, is to move that the minutes of the Health and Wellbeing Overview Scrutiny Committee held on the 31st of August 2023 be approved as a correct record. Are they approved?
Agreed, Chair.
Agreed. Thank you. Right, item 3, any urgent business. I just wanted to raise 2 issues. One was this group set up 2 committees to look at obesity and mental health services. This has been a challenge to enable due to actually officers being available to facilitate this. I've been assured that come January those officers will be available to help support these groups, so it will slip the kind of plan to have reports by March, but I still think that these groups are really valuable to continue, so I look forward to the support that the committee will get in January. Right, I just want to make a statement on the IMCs, because obviously it was decided in 2017 that there would be 4 IMWCs developed in Thurrock, and then there will be the closure of our much-loved Orsett Hospital. However, only one of these IMCs have actually been set up, which is in Corringham, which is very disappointing. I note that the Grey site looks like it's planned for the Thurrock Hospital site, which is good news. However, the business case was rejected for the Tilbury Purfleet site by NHS England, my understanding due to cost. To this day, Thurrock Council has not received a written reason why the business case has been rejected. I'm very disappointed and concerned because Tilbury has a really high need for this type of medical facility, with the life expectancy of Tilbury 12 years shorter than any other part or other parts of Thurrock. And Purfleet has the largest growing population within the Thurrock area. In a HOS meeting on the 19th of July 23, we were told that Plan B would be developed and ready for September, and was going to be presented at today's meeting. I have received a call from Alex Meekan, who requested that this meeting would be deferred until she had the opportunity to talk to Dr. Dave Smith and Ian Wake. I reluctantly agreed to this because I really want a plan that is actually going to work for the people of Thurrock. Rather than keep kicking the can down the road with a plan that's not going to work, at least the people of Thurrock will get something better than they've currently got. So, I have discussed this with Councillor Cockshaw, and we have agreed to do a joint letter to NHS England, I think Claire Panica, asking why the reason for the business case was rejected for Purfleet and Tilbury, and what they're likely to be doing in terms of actually ensuring there's adequate funding to develop the IMCs for Purfleet and Tilbury. I hope my request is the committee supports this joint letter from myself and Councillor Cockshaw. Do I have that agreement?
Very much so, Chair. Very much so.
Councillor Tandy.
Yeah, you just, what was, to clarify the Allsit, what is the outcome of Allsit Hospital?
Do you would like to answer that, Alex?
Thank you, Chair. Sorry, can you hear me? So if I could clarify 2 points, if that's okay. So with regards to Tilbury and Purfleet business cases, they have not been formally rejected yet. And I've had that conversation with Ian and other council colleagues. The regional office have identified a number of queries around the affordability, and because of those, we need to work through them as part of preparing Plan B. Again, happy to discuss that in more detail, and that the details of that will be put into the formal reply that will go to the local place-based committee, TICA, before coming to HOSC in January. With regards to your query about Allset has not yet formally closed. What we're trying to do is utilize the premises to best of ability, and in a staged approach, first part of that is the development of the community diagnostics hubs on the Thurrock community site, and gradually looking at moving certain services that are suitable, best suited for the Thurrock hospital site from the point of integration. Again, we will cover all of that in the document that will come to you in January.
Councillor Spate.
Thank you. Two things come to mind. I'm quite disturbed that we have a briefing that the chair has called because of his concern, and it appears he's been given disinformation, which is quite concerning. But I'm sure Councillor Hooper can deal with that in his own time. I am a little bit worried now, again, that the terminology that was just used and the phrase that Alex just used about Allsit Hospital has not yet closed, but in the tenor and the context of which it was said, it was almost said as if Allsit Hospital is going to close and, you know, we're down a process. We must be quite categorical. We have been told since day one of the IMC project, that Allsit Hospital will not close until every facility is replicated across the whole of the borough. Now, if you're changing the tenor of the language, that is of great concern to me. Not yet closed implies it's going to be closed. We have a commitment from the Foundation Trust and all the health services. There's no doubt about it, it's unequivocal. Allsit Hospital will not close until. And that's a lot different to not yet closed in terms of tenor. I appreciate his speech, but I must make that point most strongly, because that's what you've been telling this council and the residents of Thurrock for the best part of nearly a decade now, and I don't like to see things slip.
Thank you, Councillor Spate. Councillor Polly.
I would like to support Councillor Spate's comments, and that is exactly my understanding from the inception of the IMCs and the need to look at perhaps providing increased services in the borough, not just replicate what is already available at Allsit Medical Centre. It hasn't been a hospital for a very long time. We still, but it's terminology that is associated with the site. I understand that. But I would agree 100%, and I would encourage if we could have some input to Chair's correspondence and the portfolios holders. In addition to the IMC, I mean, for 6 years to be saying now that these business plans have gone, we've seen a change in the greys, the siting of the greys one, the size of the greys one. We've seen the community diagnostic centre overtake everything that was in the pipeline for the other three. Although we have a physical building that is delivering some services in Corringham, we still have not got the full complement of services that we were initially promised from there. I know there's still work in progress, but I support Chair's actions and would wholly agree that we need to take it to the highest level that we can. And this is meant in support for you guys as well, because you know, you're stuck in between. You're not the decision makers in that regard, are you? But you have to come and face us repeatedly, and it becomes increasingly difficult when the slippage of this is going down the same lines as we've seen before. But very much, I thank you, Councillor Tandy, for raising the issue of ALSIT, because that must not get lost in this message. Our focus is on delivering the IMCs, but in the same time, we do not lose any facilities at ALSIT until the other ones are in place. And again, I can only concur with Councillor Spate. I think he's absolutely right that this has got to be fundamentally ingrained. It's not a case of when ALSIT will close or these services will continue until those other IMC, or until those other services and more are delivered in Thurrock, not in remote locations outside of the borough, which makes it difficult. The whole idea was that we would make, you know, like the cardio services, the diabetic services, you know, that there would be improved clinics and health facilities within the borough. We don't want to get into a situation where we're seeing people having to go to Chelmsford or to Southend, you know, going further distances than they're already travelling. So I very much welcome this action, Chair, and I think on this occasion all members of the committee are unanimous on this.
Thank you, Councillor Polly. Councillor Tandy?
Yeah, I mean, obviously, just writing black and white, the clear message that everyone knew for the last 6, 7, 8 years was the 4 IMCs would be built, also it would close. But now it's like wish and wash. So that was a clear message that everyone, the whole public, understood, and which everyone was fine with. But obviously, only one's been built, so it cannot close at all.
Thank you, Councillor Tandy. Councillor Piccolo?
Thank you, Chair. Yeah, I just want some assurances that if you do find somewhere to relocate the services from ALSIT, that wherever they're put, it's going to be capable of dealing with the same level of usage that it is at ALSIT at the moment. I mean, I wouldn't want something moved out of ALSIT to a surgery somewhere else. And ALSIT is dealing with sort of like 50 patients a week, but where this is, it's just not capable of dealing with that number. So I'd hate to think that we found somewhere to place that, but it's not the same level of service.
Thank you, Councillor Piccolo. Alex?
Thank you, Chair. So if I can absolutely assure you, Councillor Piccolo, that is the intention, that we will ensure the appropriate capacity and demand analysis as part of that. What I would also like to ask for is to seek Council's help in ensuring that we maintain the transport services to all these locations, because we know the bus routes are precious, particularly for our elderly. So again, if we can work together to making sure that we factor that in our discussions, that would be much appreciated.
Councillor Spate?
I just would like to make the point as well that this is dropping on Claire Paniker's desk. Let it not be forgotten that Claire Paniker was the architect of the IMC project when she was with the Trust. You know, we take it all that way back. There's nobody more informed about Thurrock's IMC project than Claire Paniker, because she was the person who waved the flag when it was launched and championed it. You know, well, unusually for me, words fail me with this. It's appalling.
Okay, Alex, thank you. Thank you, Councillor Spate. I would ask you come back with a report in January's next meeting. I really kind of insist on that, really. You did make a statement in July's meeting that Allsop Hospital would not close. My worry is that Allsop Hospital has been allowed to run down without sufficient funding to keep it in good condition. And it would actually cost so much money to actually put it right, which I think is criminal, to be honest, bearing in mind we actually haven't got the IMCs that we were promised. I'm not really having a go at you, Alex, but the situation that we are in, and I think you can hear politically, every party is behind trying to get these 4 IMCs up and running.
If I may, Chair, I absolutely hear the concerns and also the sentiment that is around Thurrock for the much-loved Dorset Hospital. And as promised, I will bring the detailed report for you for January, which will include Allset. This is the MCFT site, so obviously I will need to make sure that colleagues from the Trust are present as well. Thank you.
Okay, thank you very much. Right, can I move on to item 4? Are there any declarations of interest? Councillor Polly.
Just my standing declaration. That I'm employed by the NHS, thank you.
Thank you, Councillor Polly. Right, well, unfortunately, Kim wasn't able to join us today from Health Watch, so there's no Health Watch report today. So I'd like to move on to item 6, which is Thurrock Safeguarding Adult Board Annual Reports 22-23. I'd like to ask Jim Nicholson to present the item. I think copies of the PowerPoint are made available on the tables this evening.
Thank you, Chair, and good evening, everybody. This report is available both in the bundle, starting from page 18, and separately, and also on the screen behind me. Members who were at the last meeting of HOSC will remember I presented on the strategy, the 3-year strategy, and many of the themes in that are duplicated in this, so I wasn't going to take members' time by repeating some of the comments I made at the last meeting, and we'll go through the presentation in order to present the actual annual report, and obviously if there are any questions or queries, I'd be delighted to respond to those. So if we go into the second page, there is the aim, and I just draw attention to the statutory duties. These are the requirements set by the Care Act of 2014. There are 3, which first is to publish a strategic plan, which members saw at the last HOSC meeting. Secondly, to publish an annual report, which is before you this evening. And thirdly, to undertake safeguarding adult reviews. And I'll be making brief reference to those that we've been undertaking in the period under review. So if we move on to the next slide, that's a resume for purposes of completeness of the 3-year strategy that was reported at last HOSC, and just identifies what the key themes from that were. The next slide, please, just gives an indication of some of the activities we undertook in the period covered by this annual report. I wasn't going to make reference to any of them in particular unless members wanted to, but it is quite a comprehensive programme and covers a wide range of potentially safeguarding issues. The next slide, please, scrutiny and challenge. I'd just like to make a couple of observations about that. This is a fundamental role of the Safeguarding Adult Board to hold to account both core partners, which are police, council and health, but also other voluntary and statutory partners. And there's a programme that we have in place that are listed there. The care home provision includes unannounced evening visits to care homes, which we undertake on a biannual basis. And the others, I think, probably are self-explanatory. I would also draw attention to a recent example of this, which is members may have noted in the national press recently a 40% increase in cases of modern slavery amongst care home staff. So I made inquiries as to what the position is in regard to Thurrock. Within 24 hours, I had a comprehensive response which confirmed there have been no cases reported of this nature in Thurrock, and that the systems in place to scrutinise that, to prevent that, in terms of ongoing training of care home providers and the inspection process undertaken by staff within Thurrock Council has been very robust indeed, so I was greatly reassured by that. The next slide makes reference to the safeguarding adult reviews, and members will know that these are undertaken when there's been a death or serious injury or serious abuse or neglect in circumstances which could and should have been avoided. And we had a number of years where we didn't have any of these, and I was very concerned about that as to whether our reporting pathways were adequate, whether awareness of these was adequate. We did various checks, and we've confirmed that they certainly were adequate, certainly were robust, and we have now a series of these SARs going through the process now, and there's details of these ones that are published. These are published nationally. The next slide is safeguarding data, and at the last meeting I did register the fact that this is unsatisfactory, really. The quality of this data is very limited, certainly in terms of any strategic benefit. And I'd just like to thank Ian Wake for his help in moving us forward rapidly to a position whereby we soon hope to have Power BI producing our data and our analytical results. And I'm looking forward then to have something that's far more meaningful in terms of driving activity. These are, without being too unkind to the people who prepared this, the statements of the blindingly obvious in some respects. The next slide deals with communication. This refers mostly to the work under our web, and we have had increasing levels of inquiry, which we're pleased about, and we do make sure that the website is maintained constantly and is constantly updated, and there's a whole wealth of information and training opportunities given in that. The next slide on engagement, I'd just like to say that, of course, for many people, and certainly the people that we are concerned about, they don't have access to websites. So therefore, we have to make sure that we are engaging with people in those circumstances too. And examples are given there. We had a stand at the Orset show recently, which we did in conjunction with Children's Board, and there's a combination of other events which take place out in the street, not just in Grays. I think in the past there's been thoughts that these were Grays specific. They certainly are not, and they are borough-wide. In terms of training, we provide a wide range of training at no cost to both statutory and non-statutory partners on a wide range of safeguarding issues. The conference, I'd just like to say something about this. This was held in regard to modern slavery, and members may be aware that this is a subject that's been used as conferences by police and by the Community Safety Partnership. One of my key jobs is to make sure that when we have these events, we're talking exclusively about safeguarding. Otherwise, there's an awful lot of mission creep, and we end up duplicating others' work, which is hardly a wise thing to do. The conference was attended by 66 people. It was very well received, and I'd just draw attention to the quote to the left. This is from a senior representative of the Salvation Army, who have a national role in this, and if I could just read it, it was inspiring to hear how Thurrock are so ahead of the game, so to speak, with work around modern slavery. And one of the tangibles, one of the outcomes of that was that when we did a pre-event questionnaire, the level of awareness of modern slavery and how you deal with it was in the low 20%. At the end of the conference, it's 80%. So I think that's a genuine and demonstrable outcome. We work very closely with colleagues in Southend and Essex, and there's a list of the sorts of things that we do with them on relevant issues. And the last slide gives the links to supporting documents. I would just ask if in Busy Lives members did have the opportunity to look at our easy read version. This is developed with Thurrock Lifestyle Solutions, and is an excellent document which I think wonderfully explains some quite complex things in very easily understood language. And I'm very proud of those easy-read documents, both in terms of the annual report and the 3-year strategy. And I'll pause there, Chair.
Thank you, Jim. Are there any questions or comments? Councillor Polly.
Thank you, Chair. I think, firstly, thank you so much. It's a fantastic piece of work, and again, thank you to Ian for it being so committed as he is to all of our services, and glad to hear. I think the fact that I haven't got so many questions is because of the quality of the report and the work that's been done. In fact, the slides were very helpful because in the printed report there were some statistics I couldn't read, and that was going to be my only criticism, but we have them in colour and we have all the slides here, so it obviously an ongoing concern, and I think in my other capacity we are seeing increasing safeguarding because we're going into people's homes, and we are seeing different challenges from all aspects of life, whether it is cost of living crisis and then becoming vulnerable because of increasing factors. So obviously concerned to see a rise in safeguarding issues, but the fact that we're on top of it, and I think you know, I absolutely echo your comment that, you know, if the Salvation Army are saying that Thurrock are ahead of the game, that is a very big compliment to us and to work that's done by our team and our officers. So thank you very much for the report.
Thank you very much.
Any other questions or comments?
Yeah, I think it's a very good report. Because I also sit on the other thing, and I'm conscious that it may be in there and I'm an idiot and missing it, but how much, you talk about the work that you've done with, for example, Southend and various things, in terms of interdepartmental work, and I'm sure the answer to this will be positive. You know, we sit on housing, and I get an awful lot of issues now on housing where mental health issues are very much to the fore, that they're really ingrained in some of the problems and not helped by our lack of housing accommodation and what have you. It isn't something that's specifically mentioned in this report. I'm sure you can give me an assurance that you are on adult safeguarding working very closely with housing for no other reason than I'm sure it will flag up a significant number of residents of this borough, or even visitors to this borough who are here from other areas, that do have problems. But nevertheless, we are, you know, wherever they come from, it's our responsibility as a borough to look after them in the first instance. So I'm sure you can give me that assurance, but I will just ask the question. Is it there?
Well, I can certainly give you that assurance because we have a senior rep attend the board meetings, and if there's anything that happens in between board meetings, one of the great joys of working in Thurrock is we have quite a short communication link, and so we can get action undertaken immediately if there's any such matter. So absolutely, I can reassure you of that, Councillor.
Councillor Tandy.
Yeah, the engagement idea is great. I think meeting the public and people you'll pop up and people meeting you, which obviously some adults don't have the facilities to meet the internet and everything. So have you got any near future places you're going to come and have these events? Anything planned?
Well, you'll understand, Councillor, we tend to close these down a little bit when the weather goes as it is at the moment. But yeah, we certainly do have that, and I can just check what the current programme is looking like. We're a bit limited because we have two staff members apart from myself, and we all work on a part-time basis, so capacity is limited. But we certainly see these as a very effective way of engagement, and I can think of no recent example where we haven't got at least one or two significant cases come to us just from people stopping in the street and chatting to us. So these are very, very valuable. I'll see if there's a program yet been developed, and if so, I'll be happy to forward it to you.
Yeah, is it possible we can, anyone has an event, invite you to the event and you can come?
Absolutely, yeah. But, I mean, again, with the limited capacity, I had to say that, but we're very keen to get out and about as much as possible. So any invitations will be very much well received.
Councillor Spate.
Yeah, it was interesting then, Jim, just to hear you mention about staffing levels and capacity for something that is probably only going to grow, which, you know, I mean, would that it would go the other way. And I know that you're working your damnedest to make sure that it does. But I am a little bit concerned, and I wonder if we as councillors, even at this early stage, if there's anything we can do to help you in terms of capacity. And I say that because in this very room last evening, the more or less the go-ahead was given for the council to move to the next stage of its budgeting process, and heavily involved in the cuts that are going to happen. And savings have been identified for 24-25, somewhere in the region of, on paper, 18 million. In reality, it's a lot less than that, and we're now bringing in experts, vultures, whatever you want to call them, are going to come in and are absolutely going to pick through the bones of everything that we do. And I see there are some really important working organisations within Thurrock, one of which is the Safeguarding Adults Board, and we need to ensure that it is protected, that there is no soft underbelly that accountants can get their teeth into and say we can chop this and chop that. So I would just say, if there's anything, well, certainly from myself and I hope colleagues, if there's anything that we can do to help you in safeguard your budgets, then please ask us to do so, because you know, this is intrinsically, you know, it's one of the most important things for the future of Thurrock, is we get these things right. You do such a fantastic job, and I appreciate everything that you do, as I'm sure do everybody else, but I'm not sure some nitpicking, calculator crunching people will recognise it as much as we do. So please, we're here to help you.
Well, that's most generous of you. Thank you very much. I really appreciate that. I would just make a couple of observations. The first is that the funding for the board comes also from health and from police, although the council is the major funder at the moment. We've never had any issues about that, and because of circumstances beyond our control, e.g. the pandemic, we have got a significant underspend right now, which is more than enough to deal with what we've got planned for the foreseeable future. But I'm very reassured by your comments, Councillor.
Councillor Piccolo.
I'll make a note of that, sir.
Councillor Piccolo.
Yeah, just might be a silly question, but bearing in mind that there may be in the future some reduction in funding or whatever it is, have you done a cost-benefit analysis, so that if it comes to it, you can say, well, for every £1 you give us, we're actually saving you £10 or whatever it is?
That's done on a national basis, and I wish I could remember what it was, but there is a significant payback in terms of every £1 invested in safeguarding adult work at this level. Upstream is saving a figure, and I won't try and pluck it out there. I don't remember, but it is a substantial multiplication of that.
Okay, yeah, no,
I'll try and dig it out. Sorry.
Right. Unless there's any other questions, I'd like to thank you, Jim, for you and for your great presentation and the work of the Safeguarding Adult Board, and thank Ian's contribution to helping you. But if agreeable, I'd like to move to the recommendation, is that the annual report is noted by the Health, Overview and Scrutiny Committee members.
So noted, Chair.
Noted. Thank you so much. Right, if agreeable, I'd like to move on to item 7, which is the primary care quality and access report, which was meant to be presented by Jo Broadbent, but is unable to be here today. So I think Ian has kindly stepped into her shoes.
Thank you, Chair. It feels like old times presenting a public health report to HOSC. But it's not my report, but I'll give it my best shot. So the report sets out some analyses that the public health team has undertaken into a data set collected by Ipsos Mori on behalf of NHS England. So every year, NHS England commissions a GP patient survey to assess the levels of patient satisfaction at practice level nationally. The public health team undertook a sensitivity of the analyses and the design of the survey and are confident that the responses and therefore the analyses of the responses are representative of the views of GP practice populations. The key findings are set out in the report, but in summary, you will note that overall satisfaction of residents with Thurrock GP practice has a considerable level of variation between different practices. So it ranges overall from about 30% up to 90%. And it's also quite variable within each of the 4 primary care network areas. On average, Thurrock residents reported a lower satisfaction with their practice than the England average or the Mid and South Essex average. And you'll see in the trend data that firstly, that this has been a trend over a number of years, and secondly, that satisfaction as a trend is declining both nationally in Mid and South Essex and in Thurrock. With this slight exception of a move between 2022 and 2023 where you can see an uptake. The team undertook analysis of the key subsections of the data set that looked at the breadth of experience of using GP services. And it's clear that what's contributing most to the dissatisfaction amongst our residents are issues of access. So issues of making appointments, including contacting the practice by phone. But when patients did get a service, they were largely very satisfied with the quality of the care that they received. Though it's worth noting that it is those metrics are very slightly below the England mean. The team looked for explanatory factors for the differences in the variation or the variation between practices, looking at England as a whole. And they considered 3 variables, the deprivation level within each practice population, the provision of appointments that each practice gave per 10,000 residents, and the self-reported level of ill health within the practice population. And the effect of each of those factors on overall general satisfaction is generally small. So they're set out on table 2 on page 5 of the report. So what you can see is generally where practice deprivation, population deprivation increases, then satisfaction decreases. So the more deprived the practice population, the less satisfied they are. Perhaps unsurprisingly, the reverse is true on appointments per 10,000 patients. So the more appointments that are provided, the greater the level of satisfaction. And on the ill health one, it's quite interesting actually. Where ill health, reported ill health increases, what we see is a decrease in satisfaction with access, but an increase in satisfaction in terms of patient care. But all of the levels of variation against those 3 variables are pretty minimal. So in conclusion, satisfaction with general practice is multifactorial. It reflects both local factors and factors in common with other areas. For example, the impact of the pandemic, and you can see satisfaction dropped in general during those years. And the individual contribution of deprivation, level of appointment provision and prevalence of ill health was generally small. I'd just make two personal observations, having read the report. The first is that analyses like these, whilst very interesting, tells you the what, but it doesn't tell you the why. So data should always be used as a starting point to ask better questions rather than an endpoint to conclusions. And to get to the why, I think we need actually a much more detailed and deep analysis that considers and understands differences in perhaps levels of funding between different practices. I don't have any sense of what that looks like in Thurrock compared to elsewhere. A much more detailed analysis of the workforce. So we know that we are under-doctored. We are the second most under-doctored area. But to understand the reasons behind that, so again, the why. And speaking to many of our GPs, I know they also say they're underestated, which is a terrible way of just saying they haven't got enough space for the workforce that they have got at the moment. My second observation is that we've actually got some really high positive deviants, as I like to call them. So if you look at table 1 on page 4, you can see where individual practice scores are statistically significantly above, below or in line with England. And where you look at something like the Dell Medical Centre, or Dr. Deshpande, or Dr. Devaraja, you can actually see that they are what I call positive deviants. They have scores that are statistically significantly better than England as a whole, actually by quite a lot. And so my other observation is there actually an ability to spread best practice and to learn within the PCN? So is this actually about differences in operating models between different practices? And I honestly don't know the answer to that. But I just pose it as an interesting question. But I think what we need to do now is to start to really get underneath and understand these data in the context of asking the why rather than the what. Thank you.
Thank you, Ian. Are there any questions? Councillor Spate.
You actually preempted Ian as because you know everything. I was going to ask about the why and the what in a different terminology, but I was basically going to bring it down to the key point that you just raised about doctors and the issues that we have across the breadth of Thurrock with the lack of GPs and indeed the lack of, as you described, the actual space for those GPs to operate. And this, of course, ties in to subject matter that we were discussing earlier in some instances. I'm incredibly lucky. For 20 years, I've been treated by the practice that is top rated. So I'm incredibly grateful for my personal well-being and my family's well-being from what has been an absolutely brilliant surgery. But over those 20 years, I've taken the opportunity to speak to those doctors within that practice. And there's been a general sense of dissatisfaction from within those doctors that they were not really listened to. And of course, the opportunity came when we went from the sort of orthodox PCT, then we went to the doctor GP-driven set of healthcare management and whatever. And I think we all thought that's going to make a significant change. And for whatever reason, it didn't. I think that's worth looking into. I think there really needs to be a significant post-mortem on why that wasn't better than it was. And then we look at where we are now. And I was going to ask you, so I will still ask the question, do you think we really need to drive deep and spend a lot of time finding the methodology by which we are going to get these GPs? And, and we just talk about Corringham, for example. If you remember, Corringham was going to bring in a fleet of almost apprentice doctors who were going to complete their training. They were going to facilitate added patient care and whatever. It hasn't happened for whatever reason to the degree that we were initially promised. It has to some degree now, picked up pace. But I really think we need to be specific driven and resource spent on finding out why Thurrock, is so troublesome in terms of getting doctors to come here. I mean, there are obvious reasons. Why would you want to come to Thurrock when you've got a leafy suburb with a nice practice there? But we've known about that problem for long enough, and we've got mechanisms to bring in things to combat that, or we should have. It just doesn't seem to be happening. So I'm sure it will be, but if you can just confirm that we will be deep diving into the reasons why we've got this doctor shortage, because I think fundamentally that's going to relate to most of these issues. I mean, we can talk about telephones, we can talk about access to surgeries, but it doesn't matter how good your telephone system is. If you've only got 2 doctors and you need 5, people are not going to get seen, and they're going to blame everything else.
Okay. Ian?
I'll give you a couple more observations, and then maybe some of my NHS colleagues might. I think they're probably in a much better position than me to answer the specifics. The first is actually that I agree with your analysis, and actually it's a doom loop, isn't it? Because we're under-doctored, we have the second worst ratio of doctors to patients, and so those doctors become more and more stressed and overwhelmed, and retire early or go elsewhere, and so the problem gets worse. And then when you get the newly qualified doctors, then they don't want to come here, so the problem gets worse, and then it just feeds down. So we have to break the cycle. To be more positive, I think part of the solution, although ultimately is about getting more doctors and more nurses, it's about how we can use all of our healthcare resources in a more integrated way. And if you remember what I was saying at the evening briefing that we did, creating integrated teams where doctors can work together with a whole range of adult social care professionals and addiction staff and mental health staff and community nurses, and housing actually, makes their ability to deal with residents with complexity far easier. I chaired our Integrated Care Alliance a couple of weeks ago, and we had a really brilliant GP from Corringham who was actually talking about how these integrated locality networks had revolutionised, I think was the word he used, his ability to care for his patients. So, and I attended Rita Thakaria's integrated leadership team this morning, and again was quite blown away actually by some of the stories where different professionals are forming relationships with each other and with residents to deal with that complexity in a far more effective way. So I think in terms of the model of care is important, but you're right, ultimately we've got to find a way, and we need a cogent plan, I think, from the ICB and in terms of how we're going to address this over the next few years. And I'm sure my colleagues to the left of me are happy to start to explain some of that.
Sorry. I'm William Guy, the Director of Primary Care for Mid and South Essex. So we'll obviously come back with a detailed response in January to the report, and it is a very useful report, and looking at it through the different lenses that the public health team have done has been quite insightful for us in the ICB as well. Clearly, workforce is part of the issue, and trying to attract the right workforce, getting GPs in particular into the area is critical. However, I think in reality the problems are more deep-rooted than just the workforce issue. I think that national trend on patient satisfaction is quite alarming in many ways, that kind of reduction since the pandemic in overall satisfaction with general practice. I don't think anybody working within general practice is happy with the situation. We're certainly not happy with the situation. Most importantly, the public clearly aren't happy with the current ability to access primary care services. I think that distinction between the service people receive when they can get into primary care versus the route of access is quite an important one. And the data shows that in Thurrock, as well as the rest of the country, satisfaction with services once you're in is actually very high. The kind of respect for the professionals they're seeing, the involvement in care, whether their needs were met, there's all very high outcomes from the patient satisfaction survey. However, clearly access is a major issue. I think probably everybody in this room has experienced trouble getting through on the phone to their practice, dialing many times to be told that there's no appointments left. Nationally, NHS England has set a challenge across primary care across the country to try to improve access, and critical to that is breaking this problem that we've generated ourselves, where everybody is encouraged, if not forced, to try to access primary care at 8 o'clock in the morning. We've kind of ingrained that message to people that if you want to get to see a GP, you phone your practice at 8 a.m. in the morning, regardless of your need, regardless whether it's an urgent need, a non-urgent need, not even a health need sometimes. You call your general practice at 8 o'clock in the morning. Clearly, that then overflows the phone lines, and there's no ability to deal with that in a satisfactory way. I think, as Ian does, that integrated neighbourhood teams are definitely the solution to how we work. We've got to look at primary care services beyond just general practice. You've got to think about the role of pharmacies, about the role of dentistry, about the role of other community assets, not just health service providers, but other people who can provide the solutions that our patients and population need. In order to make INTs work, integrated neighbourhood teams work, we need to differentiate demand. So we can't have a system where everybody's phoning through at 8 o'clock to try to get through to the one route of access to a service. We need to fundamentally change that. So the ICB at the moment is looking at how we can change our access model across all practices. We've got 145 practices in Mid and South Essex, in a way that allows that demand to be differentiated, make it easier for the population to get to the solution they need. And there are a whole range of actions that we've got to take to address that over probably a number of years. But we have got to break that cycle of the ATM demand in order to improve satisfaction. It will mean that people won't necessarily see their GP when they want to see their GP. There has been this historic default that if you're going to primary care, you're going to see your GP. The reality is, even if we trained many more GPs than we're currently training, there just simply aren't enough GPs in the country to meet that demand. We've got to have that broader integrated neighbourhood team approach. We've got to bring different professionals into primary care that historically haven't been there. Indeed, we have seen increased number of pharmacists, physios, social prescribers, various different roles come into primary care because of that position. We've got to make sure GPs are there leading this development and are there when they need to be able to make that differential diagnosis, deal with the complex cases, etc., that is critical to the well-being of the population. And what we'll demonstrate when we come back in January is the kind of steps and measures we're proposing to take to address that. But also within that report, we'll pick up some of those specific nuances to Thurrock, because you're clearly quite right. Thurrock has got a lower satisfaction than the rest of the MSE patch, and we need to understand what's driving the particular issues in Thurrock and how we can address them.
Councillor Spate.
Yeah, thank you for that. That's really encouraging. To try and bring something positive to the meeting, part of that appraisal of response from the public to the provision of GP practices, it's probably got nothing to do with doctors, or even when they eventually get into the care. It's a lot of people have an issue with their first point of contact with doctors' practices. I have been privileged to know quite a few people in Thurrock over the years who actually work on the front line, the GP receptionists, for the telephony, but whatever the terminology would be. They actually do a much bigger job than just answering the telephone. They do a phenomenal job in terms of record keeping, awareness of patient need, care on the phone. I mean, now, you quite often get a phone call from the GP frontline staff to discuss an issue with you, which probably didn't used to happen. I think there's probably room there, that we can show a lot more support for those people. I mean, I do know, for example, of at least 2 instances where GP staff have suffered fairly severe mental breakdowns, where the pressure and the abuse has got to them. So if we are planning a new way forward, those frontlines, it's easy to talk about GPs, it's easy to talk about district nurses and things like that, and the danger could be that we overlook those frontline troops who are doing a phenomenal job, and I would applaud take this point to applaud every single member who works in a GP front office in this borough, because they do phenomenal work and sometimes get absolutely abused. And some of the people who are writing really low satisfaction will be the ones who actually cause the problem, because they're so intolerant. So hopefully that you know, we can make sure that we also support those frontline staff as well as the pure medical staff.
Thank you, Councillor Spake. Councillor Polly?
Thank you very much. I've recently, the area that I live in and my GP surgery, my personal GP surgery was perhaps one that by reputation was acknowledged as being one of the poorer GP surgeries. I mean, I've been unwell myself recently, and I called them at 8:15 the other morning, and at 8:37 I had a call back from a prescriber, which is all I needed. I didn't need to see a doctor, didn't need to visit the... I think with COVID, what people have become accustomed to as they've got used to 111 and other things, that they are realising that there are other healthcare professionals out there now that can deal with equally as well or mainstream make their referrals for them and that. So I think as that education and knowledge grows, we will see people not as insistent on, I want to speak to the GP or I need to see the GP. They'll realise that. In fact, sometimes that there are many other healthcare professions that will help their situation. On that note, I actually had a meds review from a pharmacist. One of my concerns is, are the pharmacists actually being, whereas a GP would get paid for an appointment if I went to see a GP for a meds review, are we getting a freebie from the pharmacist? I mean, because they're quite overloaded in what they do as well, with with more longer term illnesses and sort of and aging populations. The polypharmacies, the much more demand on their services. Although I was very welcome of that, I just wonder if we're not taking advantage. I just want to make sure they're being looked after. Councillor Spate referred to the first point of contact. I now understand they're care navigators, which is I'm not always sure that these titles help situations, but I think that again is part of the culture changes, and it is try to help reinforce their position that it, like when they're asking you why do you want to speak to your GP, then they're not trying to breach data protection or trying to be trying to get you to discuss something really sensitive that you don't need to, but probably best place to try and direct your call rather than. So I think again that's around education. So I welcome the social prescribers within primary care. I absolutely agree with what we've all indicated that you need a network of services to support each other. One of the questions that I have had in mind is despite all the improvements in technology and more increased healthcare professions involved in people's support and care, we still have this problem in the GPs where they are the first point of referral. And a lot of what we've talked about with the safeguarding, whether it's and referrals for scans or things in that at hospital, I don't know if there's any research on that, where, because I understand that there's fewer people wanting to take up GP as a profession, and I just wonder if it is because of that, because they sort of effectively become social workers, or they become bogged down in that being a gatekeeper to all of those services. And if that is the case, is there anything in the pipeline to try and change that dynamic as we are seeing? I mean, I've never understood people will insist, I want to see a doctor, yet if they can't get the appointment, they phone 111 and talk to a total stranger, and sometimes they talk to a call handler, but they're quite happy to do that, but get quite irate that the person that's answered the phone at their doctor's surgery probably has known them for quite a long time, won't say to them, well, I've got a health problem that I need to discuss. I do find that sometimes we human nature is a very funny thing. Thank you.
So if I take those points in order, all really good ones. Firstly, in terms of the admin staff in practice, I completely agree with the councillor on the role of admin staff in practice and the importance of treating them with respect, not only in terms of the kind of public interface, but also with the health service valuing them. And certainly we're investing in some new training programs at Rittle University and others for our admin staff in practice, because we want to make them feel valued, we want to support them do the job they do. And they are often subject to significant abuse on the telephone systems, because they've been dealing with 95 other patients before they've got round to the individual that they're then having to battle with. And they're certainly keen to best serve the population they look after. And so I completely agree, medical secretaries and the admin staff on the front of house at primary care are really important within the future primary care model. If I take then the further points raised around some of the intricacies of this. So I think care navigation is going to be a critical part of the future of primary care, and I completely agree with you. We've got to take the patients with us on the journey around why they're being asked these questions. If you just phone and you're expecting to get an appointment with your GP, then you get asked a dozen questions about your condition. You might question why. It is all done for a reason. It's all done for a clear kind of methodology of trying to get you to the right solution at the end of the day. But we don't necessarily set that out at the outset. We're not clear with people what to expect. And so that kind of communications exercise and bringing people up with us on this journey is going to be critical. In terms of the role of pharmacies, so there is a challenge at the moment within community pharmacy. I think nationally we've obviously seen some of the big chains, Boots and others, reduce their community pharmacy presence on the high street. We've seen closure of pharmacies in some supermarkets, etc. We are starting to see even some of the independent pharmacies affected by shortage of pharmacists. In part because some of them have gone into general practice and now working in primary medical services in the primary care networks. But equally because the business model does need to be looked at, we've got to make it sustainable. NHS England are currently negotiating various new pathways and services with the National Pharmacy body, which would then get launched locally as well. But we're now responsible for the commissioning of pharmacy services. The ICB is as of the 1st of April. And so we're keen to work with our community pharmacy colleagues to make sure that they're sustainable, and they can do the things we want them to do and that they want to do. In terms of the questions around primary care being the first point of contact and the kind of gateway into the rest of the NHS, I think, and I've never obviously worked in clinical services, I'm not a clinician by background. However, I think in general, people working in primary care like that aspect of it when they feel they have the ability to do it well. I think that kind of family medicine and that holistic care that's offered by primary care over and above every other bit of the health system is why people choose careers in general practice over secondary care, mental health services or community. But it's how we can get them to a place where they can do that job well and get the satisfaction from it that I think is critical. And I think at the moment there's a lot of dissatisfaction because people feel that they're not necessarily box ticking, but they're having to process a lot of patients, and therefore they're having to do it quickly rather than do it as well as they want to do it. I personally cherish primary care, and I think we've got to protect it. But we have got to do something to get it back to a place where it can do that family medical practice well and be the gatekeeper to services that we need to protect because of the capacity constraints within them.
Councillor Piccolo.
Thank you, Chair. Just thinking about the abuse that the receptionists sometimes get, you know, where they want to ask them questions to help. I don't know whether all practices do, but I should imagine there is there's quite a long message when you first phone your GP surgery. A lot of it is still relating to COVID. I can understand that. But to perhaps let the people that are phoning understand, would it be worth putting in that message, you're now going to be put through to our triage receptionist, who will ask you a few questions to make sure that we can supply you with the best service you want. Just so that they don't think they're just speaking to the receptionist, you know. You call them a triage receptionist, you know, they think, oh, you know, so it might just take some of that fire out of their not wanting to ask, you know, to the receptionist what she needs to know.
Councillor Tandy.
Yeah, like Councillor Spate has said as well, we've got to look after our GPs. They're stretched, they work hard, there's not many about. I think instead of us thinking we should do this or do that, I mean, what is it, 27 surgeries? I think the question should be asking them, what do they want? How can this be better? Asking them, giving them a bit more TLC, and let them ask the questions, how we can improve it, how we can help.
So picking up both points, the first one around the messaging on the phone, I totally agree with you. And coincidentally, last week I was speaking to one of the local GPs, and in their practice, they've done just that. And they, within one of their practice meetings, they decided between them, I don't think they squabbled, but which GP had the most trusted role within the practice. And that GP's done the telephone message saying this is what's happening. And they have already noticed quite a difference in how receptive people are to then having those questions asked. So we will take that learning and make sure that that's the common approach across practices. It may lead to some arguments about who is the most trusted GP, but it's probably worth still pursuing. In terms of the point around asking the practice themselves what would help, so we're doing that, and we're doing that in multiple ways. So one of the ways we've already done that is we've done an exercise with primary care networks, asking for their input into what challenges they think that they're facing, and what support the ICB can give them to try to address some of those challenges. Equally, we are following that up over the next 5 months with visits to every single practice in the system, 145 of them, in what's called a support level framework visit, which is part to challenge and to get them to think about different things, but equally is that feedback and us being receptive to what they've got to say, and actually how some of the issues they're encountering that we can support them address. So we will use that feedback on a continuous basis to inform how we support primary care address this access issue. But I completely agree with you that the people at the coalface have got to support this change.
Councillor Spate.
Yeah, just coming in on the back of Terry and Jimmy there, it just suddenly struck me, and let's hope that the vultures are not sharpening their talons and looking at them, but within the borough we have the Borough Education Awards. We also have the Borough Civic Awards. Now, they're generally sponsored, so hopefully they're cost neutral at the end of the day, other than the time of putting staff into it. We even have our own internal staff awards and whatever. The one thing, and I'm embarrassed that I haven't ever thought of this before, you know, is there a scope here for saying, why don't we launch in 2024 the Thurrock Health Awards, and we ask the public to nominate those people who are doing well? Because, you know, if you shine a spotlight on things that are good, it always has a better effect, because it will raise expectation levels. We'll have a go for that next year. We can put somebody in and whatever. It shouldn't cost a lot of money, and it would be a tangible thing that we could do. I mean, I'm looking for things that we can do as an authority to assist you guys and the guys in the front line of healthcare. So, I mean, I don't quite know who we bounce the ball into, but I would suggest that this and I can do it by a members' inquiry if you want, we think about the possibility of launching a Thurrock Health Awards to recognise, you know, the pharmacists, the district nurses, the frontline staff within whatever, not necessarily the ones probably who wouldn't want to take part of the doctors, but, you know, all the people, we could find a way of showing our civic appreciation and our civic support for them. I think that would help raise the bottom numbers on that fairly horrific table.
Thank you, Councillor Spate. Good idea. Ian?
I think it's a wonderful idea, actually. What I suggest we do, we'll take it back to our Thurrock Integrated Care Alliance and discuss it with partners if we could do it jointly. We could maybe have more than one category. My only plea would be let's make it health and care, because often the frontline carers get left out of this. But if we could find a sponsor, then I think that's a really lovely idea.
Okay, well, I think this is actually a really great report, and I'd like to thank Joe and the team to compiling this report. I do think we're talking changes of culture when we're talking about some of the things we talked about earlier. Historically, GPs was the first port of call you went to go to other services. Now we're talking about different routes for you to do that. I'm very much involved in one GP practice where care navigators hate being called care navigators. And I really think Councillor Piccolo actually really come up with a good idea about what should be on the voicemail system before they actually speak to a person. I really am interested in how we improve the number of GPs for Thurrock. I choose to live in Thurrock because I think it's a great place to live. And I really would like to look at more about how Thurrock Council and Health can work together to make it more attractive for GPs to come here. I think one of the things that I really want maybe a bit more information on is how many GP practices actually take on trainee doctors. Because I think if you've got trainee doctors coming to Thurrock, training in Thurrock, they're more likely to stay in Thurrock. So I'd really like that kind of looked at and really promoted across our GP services. Councillor Spate?
Sorry, I've just had an idea, and if I don't get it off my chest, I'll forget it. Talk about contributing and bringing things in. You're talking about helping bring people into Thurrock to work within the care industries, and it just suddenly, remembrance, I helped somebody who operates a care home, who's got a property change, he's created an HMO, but he's made it specifically for hospital nurses or care staff, and I sort of badgered planning on behalf of that. So again, if we can maybe look at, are there ways that we can go and say to planning, can you look a little bit kindly and not necessarily make exceptions, but accept that there is a need in some instances for specialised housing, and particularly HMOs for young people who are coming into a profession, and so we can ask our colleagues in planning and whatever to possibly help us.
Councillor Polly.
Just to come back to that, to Councillor Spate, I think on housing, I think we did have a policy for key worker housing. So I'd go to directors for more information on that, but probably, as I sit on planning, I would suggest that that might be there is planning legislation, planning law. We couldn't. I think that I don't believe that we could grant planning permission on a property just because it was offering HMO accommodation for healthcare workers.
Or maybe it's something we could look at in the local plan. I think it touches on it a little bit in the local plan. But I think overall it's a good idea if we can provide housing for our health workers. So I think it's something we should encourage. Right, could I move on, if that's okay? So I'm asking that a report comes back to us in January as a response to the report by Joe and the team. Okay, so would that be Alex and William doing that? That's fine, thank you. So I've been asked, the recommendation is the committee is asked to consider the findings of the GP Patient Survey 2023 summarised in the attached report, evidence pack, and the implications to local NHS practice. So I guess that's noted, yes? We have considered the findings, I believe.
It's not actually a recommendation.
Councillor
Okay, if
Hooper,
I can...
Councillor Hooper, obviously you've made an alternative recommendation, haven't you? Can I just check that's been seconded and who by?
Seconded by Councillor Spate.
Lovely, thank you.
Right, if I can move on to item 8, an update on Mid and South Essex NHS Foundation Trust. And I'd like to welcome Fiona Ryan to give her presentation. Thank you.
Thank you,
Just hold
Chair.
on.
Sorry, just 1 minute, please.
Okay, Councillor
Sorry,
Polly.
just a point of procedure, really. Yeah, I'm appointed by this council as a governor on the MSC, so obviously, just because it's a report from that, I need just to make that note. Thank you.
Thank you. So, Chair, if it pleases the committee, I'll just cover off a couple of points that were raised when we last met, and then I'll move to an update on the CQC report for medical services, quickly pull out some of the highlights from the operational and quality report, and take questions. Okay, so firstly, in relation to some issues that we discussed when we last met, there were some concerns raised around failures or issues in the ability of Healthwatch to advocate in the complaints process with MSC. So Healthwatch members, the ICB and the Trust met to understand where these issues were arising and to agree a standardised process for both management of complaints, management of consent in these cases, and escalation of any concerns. So that's all been agreed, and we will continue to keep in touch with each other very closely to make sure that we don't have any issues arising along those lines again. So thank you to committee members for raising those concerns. The second concern that I wanted to address was some concerns in relation to patients exiting specialist cancer care at the Southend site and their ability to access into community health care on their discharge. So that matter was picked up through the leadership of the Southend Oncology and Cancer Services, and there has now been clear education and provision of information for all staff members that manage discharge of patients across Southend as to how they access Thurrock community care, and again, escalation points put in place for any concerns that arise. We have got an update on haematology. There was a question raised by a member last time around the wait for haematology. You'll see from the information presented that, like most services, we have seen increased demand. Haematology has seen a 25% increase in outpatient referrals, and the current average wait for an appointment is 8 weeks, which is better than a lot of our services for access for outpatients, regrettably due to the extent of our waiting list, which is covered in the report. So if I can just move to the CQC report. So as I updated you when we met in July, we had been revisited by the CQC at that point across all 3 sites. This was in relation to the inadequate ratings that we were given for our medical services. Following that visit and subsequent to the submission of the report by a matter of days, the CQC updated report has now been released. The Section 29A warning notice has been lifted, and our medical services are rated as requires improvement. The CQC noted improvements in a number of areas around risk assessments, governance, nutrition and hydration, Mental Capacity Act management and deprivation of liberties assessments, as well as design and maintenance of equipment and how we keep our estates safe, particularly in patients with mental health conditions. Clearly, there's a lot more work to be done. Requires improvement, is not where we want to be as a hospital at Basildon or on any of our sites. And so we continue our focused work to generate further improvement, all of which is subject to regular auditing and monitoring to ensure not just that the improvements made so far become embedded, but that we continue on that improvement journey, and the details of which are, some of which are in the report that was shared with you. So if I can just quickly move to our update, our operational update. So we just wanted to update the committee on the impact of industrial action. So you'll see from the report that industrial action has had an impact on our services, on our staff, and on our patients. We've worked very hard to manage these periods of increased risk, but the impact to some of our elective operations is inevitable. In total, we've cancelled over 4,000 surgeries since April. Every effort is made to mitigate that impact on our cancer waiting patients, because those obviously being the highest risk in terms of their outcomes. And so, but inevitably 10%, some 10% of those surgeries that were cancelled and therefore delayed and had to be rebooked during the time period to date were on cancer-related pathways. We've also had to cancel 30,000 outpatient appointments since April, combination of new and follow-up. Again, some 10% of those were related to cancer pathways. Obviously, those patients on cancer pathways are prioritised for rebooking, but the impact then is felt on those patients that have already been waiting for far too long as we continue to work through the backlog as that we are faced with as a result of the pandemic. In terms of urgent and emergency care, I know we had some discussions on this last time. Our EDs remain very busy. Our ambulance arrivals have increased by 50% in the last year, and that demand puts incredible strain on our services and makes the workload quite difficult to manage at times. That said, it is obviously a clear priority for us, and we continue to manage that risk by focusing on triaging patients as they arrive to ensure that patients get to the right point of care and are prioritised in the right area for the capacity that we do have available. So our triage time at Basildon Hospital was 5 minutes in September, and we are in a much improved position in relation to our ambulance offload performance as well. It's a real area of focus nationally, but really for us, this is about making sure that we release those vehicles to the community, to those patients that are waiting in their homes for that first point of care, where that first point of care is an ambulance or paramedic arriving. We did touch on cancer performance last time, and we had some discussion about the faster diagnosis standard that's been introduced nationally. We have had a little bit of a deterioration in our performance against the faster diagnosis standard. So we were at 68% in July, and we deteriorated to 65% in August. Much of that is the cumulative impact of the industrial action, but we remain on our original trajectory to get to the 75% by March, the nationally required standard. Just quickly, other things that I would highlight. So we have got the majority of our patients that are waiting over 65 weeks booked now for appointments. Our outpatient waiting list is still an area of focus as it is nationally. The total waiting list for the trust is about 167,000 patients. of which approximately 17,000 are waiting for surgery. This is obviously some considerable numbers across our area of responsibility, but we set ourselves targets for as we focus to bring that waiting list back to where it needs to be. You'll remember from previous reports that we had a number of patients waiting over 104 weeks just a year ago. So at this point, we have reduced our 65-week waiting list by from 90,000 patients down to 20,000. So the work continues. There is some information in the update just to bring some good news and some development information to you all, just about the stuff that our wonderful teams are getting up to. So at the CTC at Basildon, one of our teams have recently implanted the UK's first leadless pacemaker. So I don't know if anybody knows anybody who's got a pacemaker implanted, but these new devices can go in via the leg rather than in the chest. Their batteries last twice as long, they're much less invasive. So whilst we deal with all of the pressure and challenges that we deal with on a day-to-day basis, our teams continue to push forward with developments that improve care for patients once they get into our services. And we've also had just opened our redeveloped simulation suite. So this is where we do a lot of our training for procedures. And so if anybody's ever on the Basildon site and wants to come along and see the mannequins in action, it's actually a well-proven way, and actually is used in advertising on the television quite often now in relation to AI. But these mannequins can breathe, they can scream, and they can react if you don't treat them in the right way. So just some of the things that the Trust is doing to support staff to develop the skills that they need to care for our patients in the best way possible.
Thank you, Fiona. Questions? Councillor Spate.
Thank you for that report. There appears to be an omission. You said at our last meeting you would bring us a report back on the gentleman who was discharged and died. And there was a fairly critical appraisal of the Trust and the hospital, and you did say you would look into it, it's actually in the minutes, and bring us a report back to this meeting.
Apologies, I wasn't aware of a requirement to bring a report back on that matter.
Okay, well, maybe we could have something at the next meeting. I don't really want to go into details of an individual,
Not sure about
but
individual patient detail would be appropriate.
no, I don't think an individual detail appropriate, but maybe a story. Okay.
Noted.
I thought
Sorry, Chair, I'm not having that. Sorry, I raised that issue, and it wasn't. It was not an issue about an individual. It was a critical, an external service criticism of the Trust, and Fiona said she would bring a report back, and it's in the minutes. So I don't think we can just pass it over and say we'll do it next time. That's what we're going to have to do, but. You know, it's an important thing. This is a gentleman who died. His family, his friends and other people are extremely concerned. So are other people in similar situations. We can't just gloss over it.
Can I just clarify, the minutes say Fiona Ryan responded that she doesn't have the details, she will make inquiries and report back to the committee, not that she would do a report.
Okay, Fiona.
Apologies, I wasn't aware that I was going to bring a report back. I do think that we have to avoid discussing individual patient cases, but I will make sure that I come back to Councillor Hooper with some further information.
And your point is noted, Councillor Spate. Any other questions? Councillor Polly.
Thank you, Fiona. As we discussed with the primary care, I am aware that, especially at Basildon, there are multiple processes in place at the moment to work with other healthcare professionals and with our colleagues in care, as always, about discharge to home, community, virtual hospitals and community in place in the care. Obviously very concerning about the numbers of pre-elected procedures that have had to be cancelled. I noticed that we had some very good ambulance ED numbers. Is that affected by the fact that because there is no the cancellation in the elected procedures mean that there is bed capacity? So from the ED's department, there is actually capacity to move those patients on where needed. Rather, it is one thing. Although it's a good statistic, as Mr. Waite quite rightly said, data just starts the process. You need to drill down. I used this term last night, nitty-gritty, and I'm going to use it again. We've got an improvement in those numbers, but what is the rationale behind those numbers? Because as we all know, not that NHS is ever out of winter pressures, but the change in the weather conditions, the respiratory illnesses, we know that COVID numbers are on the rise again. I do acknowledge and commend some of the actions that have been taken. For example, the same-day emergency care, when we're talking about GPs needing to refer patients quite quickly. Again, that's taking things away from ambulance services and taking them out of the ED, that there is a pathway now that if doctor feels that they want that person to have a blood test that day or have a particular, it may be an x-ray or something, that, there is something there to support the GP surgeries. So I have witnessed that there is a huge effort coming out of Basildon to try, along with the rest of the NHS and that, to try about not working perhaps in more traditional ways that people have become familiar with, and using some more expertise and some newer technology, as you've said. The diagnostic centre in Pitsea, how's that going? Is that taking some of the pressure away from some of your... Because what we've had before is people arriving at ED because they're waiting so long for their referrals to come through. And there was just one other question around communication letters as well, letters that were going out on an automated system from the MSC. It wasn't just an MSC problem. I think there was some software problems identified, were they? I just wondered if we've caught up with all of our missing letters, and that all surgeries in Thurrock are, to the best of our knowledge, have now got all the relevant information regarding any hospital attendances for the residents of Thurrock. Thank you.
Thank you. So as to your question as to whether the improved performance is related to capacity as a result of reducing that inpatient elective activity, there certainly is a correlation in our bed occupancy when we look at our data. So there's a correlation between bed occupancy and the incidence of the industrial action. There isn't, however, an equation with the turnaround, an equivalency with the turnaround in ED, because we are operating on a much reduced medical workforce. So in the event that we had a fully staffed hospital at that time, it would give us that opportunity. But in relation to the other performance metrics correlating directly. Occupancy is the only one that does correlate in that instance. And I think just the degree of improvement and the fact that it's been sustained is a testament to the hard work of our ED teams in particular. We remain very congested within the ED departments and within the hospital bed bases. So it really is just testament to the work that they do in effectively triaging patients and really focusing on releasing those ambulance crews as rapidly as possible. In relation to your question around the CDC at PIDSI, so certainly the CDCs can and should and will increase our available capacity for all of our diagnostic services. Getting patients through into a diagnostic service and therefore with a diagnosis means they can start the right appropriate treatment more quickly and should help to manage demand across all of our services, be those primary care or in secondary care. So I think I view them as being really fundamental to moving forward and including bringing some of those types of activities away from our acute hospital footprints and closer into the community. I think they're really, really important. We will be, whilst we're building the CDC at PIDSI, we will have a temporary unit delivering endoscopy at Orset until that capacity comes online, so that we don't have to wait until the build is complete to make sure that we've got enough capacity, because we see that year on year demand for those procedures increases by some 10%. So we're trying to make sure that we're building some interim capacity into the system as well, so that we can continue to cope with that demand. In relation to the GP letters piece, that's not something that I'm directly close to, but I wonder if Alex might be able to update for Thurrock in particular, because I know a lot of work has gone onto it, but I couldn't give you a progress update as to where we are today.
If I may, just to come on this one, the IT glitch has indeed been sorted, so that's on the kind of MSc on the trust side. The work is happening still within the GP practices. Our GP practices in Thurrock are fully engaged and on board. And what we're doing now is we're carrying out the harm reviews, so ensuring in stages that no patients have come to any harm as a result of those. So this work is in progress, is progressing well. And again, once it concludes, we'll be able to bring you a full letter. But so far, like I said, full engagement and no major challenges identified in Thurrock. So hopefully it stays this way.
Right. Councillor Tandy.
Yeah, just for my reference, do you have stats of waiting at Allset or Basildon? Do you weekly look at the stats of average waiting time?
For which service? For A&E, yeah, so we monitor our A&E waiting times probably 6 times a day. And we meet about them face to face 4 times a day. So we are especially focused on where we have long waits for patients to get into an inpatient bed. So we talk about those individual patients and their individual plans multiple times per day. And we look not just within Basildon Hospital, but we look across our 3 big hospitals with their ED departments to see how we're all faring together to ensure that we're doing everything that we can to support each other and support our population together.
What direction is the waiting going? Is it going up or down?
So our ED performance, so the number of patients that are waiting for 4 hours is improving. At Basildon, it's improved to about 70%. We're aiming to get to 80% of patients seen and treated within 4 hours. That's not the standard that we worked with previously, pre-pandemic, but we are focused on getting to that point so that we can plan forward from there.
Okay. Councillor Polly.
Sorry, me again. Just would like to compliment Basildon as well for their mental health urgent care department. What an amazing facility. That's again, we I think we all are quite passionate about mental health on this particular committee, but to have effectively an emergency care department for mental health where people can walk in and get assessed on the same sort of basis as a normal ED department. That's been one of the biggest problems with mental health is the availability of services at times when people are usually in crisis, and yeah, I had a personal friend use it recently, and I think it's going to be one of those services that will be a victim of its own success. It will very soon, as soon as it gets known in the broader fields, I feel sure that will reach capacity quite quickly. But I don't know how that compares to nationally, but I would think that that's probably quite groundbreaking to have that facility at Basildon. Thank you.
So I can't speak on behalf of the Mental Health Trust, but I would echo your sentiment entirely. We know that as the next door, the next door neighbours in terms of our ED department, we have so many fewer patients waiting to access mental health, and we do have a mental health suite within the ED department, but it's not a mental health urgent care department, so it's been, as you say, a great success.
Thank you, Fiona. I hope that the unions and the government come to some sort of arrangement soon, because this is actually having a negative impact on the people within South Essex. The CQC reports, though I'm pleased to see there is an improvement, obviously there's a lot more work, and there's also concerned about the CQC report on maternity services, which is also the last report on maternity services, required improvement. I'm really keen to see the action plans and where you are with the action plans in terms of actually improving services, not necessarily you talked in your report about the fact that you are monitoring how you're going. Could we have maybe some information about the reports on monitoring your services and where you actually are?
Yeah, thanks, Councillor Hooper. Obviously, it's been some years since we've had our maternity services inspected, and like most maternity services in the country, they've been an area of intense scrutiny alongside neonatal units due to recent events. Just for assurance for the committee, we are monitoring very closely our neonatal death rates and the relevant standards at which they're measured against, the Embrace standards, and there are no flags of concern in our data, but equally we are undertaking additional activities around presenting staff members with opportunities to speak up, additional opportunities to escalate any concerns that they do have. I will take an action to invite my maternity colleagues to provide me with a report for you all for next time.
Thank you. I'd like to apologise for Councillor Spate, because in the minutes of the last meeting, the Chair did require the hospital to look at the case raised by Councillor Spate at the start of the meeting, where a man had died as a result of being discharged from hospital. I think I'll be very keen if we can move that on fairly quickly, Fiona. I want to bring it back to the next meeting, but maybe for the sake of the families and Councillor Spate, we could actually move on that fairly quickly.
Yes, certainly.
Thank you. Are there any other questions?
Just, yeah, I was going to mention it under the work programme for January, when Fiona will be coming back, and in there I would be particularly interested if we could look at the a report or part of the report be based on the fabric of the building at Basildon. There have been some issues of late, and indeed, wearing my other professional hat, or my only professional hat, I wrote a story recently featuring comment from Jonathan Dunk, acknowledging that there were still some substantive issues with things like water getting into the building, problems in corridors, and whatever. So if maybe we could, just as part of your report, give us a sort of fabric update on the building, because again, you know, we can hopefully bring pressure to bear on your behalf. If you need more money, we can fight for you.
Yeah, we certainly do have significant backlog maintenance challenges across the estate. Parts of Basildon Hospital are very aged, and we've already spoken about the issues at Orsett. As we all know, the patch and repair approach is not the most cost effective, so I'll liaise with Jonathan to give you an update on where we are in terms of capital as it relates to backlog maintenance.
Any other questions? Okay. That being the case, can we move on? I know you kind of touched on it, but I want to come back to it, which is item 9, phlebotomy service update.
Okay, so we did give you a paper just with an update specifically around phlebotomy and services in Thurrock. Phlebotomy demand continues to grow. We have actually seen demand for phlebotomy appointments grow from 30,000 per month in 2020 to 45,000 in 2022. So as you can see, quite a significant increase. The paper lists a number of actions that the team are taking to support the Thurrock population, particularly within the constraints of the available capacity, to ensure that there is improved access to urgent appointments. They have done this by ensuring that GPs have got access to a telephone number where they can specifically book urgent appointments for patients that they are concerned about. They have revisited the timetables to increase the number of urgent appointments available, increase capacity on Saturdays at Basildon, and continuing to offer additional clinical hours in both Basildon and Orsett when staffing allows. They've also increased capacity at the Corringham IMC. I touched briefly last time on the challenges that we have around DNAs in the service. The Thurrock DNA rate is one of the highest levels across the areas that our phlebotomy service covers. In August, there were 2,931 DNAs, and so I think it's really incumbent on the service to work very closely with patients and GPs to ensure that there's really improved understanding of the impact of what effectively becomes then wasted resource within our community, which we can all ill afford. Staff in the service obviously is a challenge. There is a level of turnover within the service as people often progress on to other care roles, having spent some time working as a phlebotomist. So the approach that the team have taken is to work with individuals who are trained as healthcare assistants and kind of create hybrid roles and hybrid employment opportunities to ensure that we mitigate that element for individuals within the workforce who want to explore other careers, but maybe without having to step from one into the other. And particularly focusing around the quality of the training that the phlebotomists receive, so that we have got an output from an appointment in terms of a blood sample on its way to the laboratory.
Councillor Piccolo.
Thank you, Chair. Couple of things. I'll start with this as an example. You go and see your doctor. He's very concerned and asks you to have a blood test. You have to wait 8 weeks at the moment. If I'm looking to book an appointment online through Swift, it's an 8-week wait, and then there's a week for that information to get back to the doctor. That's not acceptable. I know you might have problems with it, but that's not acceptable. You've also brought up the fact that there's a lot of people not attending. Maybe that's because they booked a blood test in 7 weeks' time, their condition has got worse, the doctor has sent them to the hospital for something else where they've done that blood test. Now, is there any way of correlating whether or not that might be one of the factors that you've got a lot of no attendances? It's because, in actual fact, because they've had to wait so long, they've had to go in hospital when blood tests have been taken out as part of that treatment. The other thing that concerns me a little bit, and this is a personal or something, is that I've got an appointment with the hospital in 8 weeks' time. I have to have a blood test a week before I see the doctor. Now, I can't guarantee that I'm going to be able to book that blood test because of the fact that, you know, I can have a look in 3 weeks' time and hopefully there's going to be something on that day available. But there must be some method, or there should be some method, where doctors, and there may be, I don't know, there must be some way of doctors making sure that if they think the blood test is that important, and actually I've just been reading something, it seems that they could do that. So if you can just clarify those few points for me.
So in relation to triangulating where that, what's the root cause behind why patients are not using their appointments, and are they having to access that service through a more urgent route because we're not delivering it in a shorter time frame? I will ask the team to have a look at that, and I'm not sure if they've done that particular investigation, but I'll certainly ask them. In relation to being able to access an appointment in a timely manner in relation to your follow-up appointment, etc. There's a number of routes. So obviously for the GPs, they have got access to urgent appointments, and there's 2,000 urgent appointments available every week across Thurrock. But we also have got across Basildon and also hospitals same day or walk-in appointments available for patients that are required to attend for hospital appointments. So
I understand you've got the walk-in appointments, but that you could be sitting there for 2-3 hours, and if you've got dependents at home that rely on you being there, you can't sit somewhere for that amount of time. I'm just pointing out that whilst they're available, they're not available to everybody because everybody's got circumstances that might prevent them from being able to do that.
I'll come to Councillor Spate in a minute, but I guess my observation in terms of that response is it's a bit like the GP practice. It becomes the race to get, normally it's 25 people on a particular day who could actually get a walk-in appointment. And it is literally a race, and people turn up and then people are turned away. So I really think that needs to be looked at. I think more walk-in appointments actually would be really helpful at this time. Councillor Spate.
Same subject, and thank you, Terry, for raising it. I have had cause on 2 occasions in the last 3 months to require a blood test. It wasn't urgent, but it was relatively quickly, as quick as you can get it done. So I went on SwiftQ and had a look. The nearest, within Thurrock itself, as Terry said, you were talking weeks. It was not possible to get anything close to home. However, if you just broaden the search, which the system, if you scroll down SwiftQ, I could get same-day appointments booked in Kent, in Dartford, well, Dartford's obviously in Kent, and various other areas over the river. I could get appointments in Southend. I could get appointments in the Basildon area, and indeed, I booked 2 appointments in those 2 instances. On the first one, I went to, I think it's St Mary's Church, there's a school or a clinic next to St Mary's Church in Wickford, and on the second occasion, I went to St Andrew's in Billericay. and they were same-day appointments that I was able to make. Now, I control my own work diary. I've got the ability to get there. I've got a vehicle. I can afford to put petrol in my car to go and get that service. There are a huge number of people in Thurrock who can't do that. And that is just a monumental disparity. And it's really not fair. That shouldn't be the case. If you can get a same-day blood test booked in Billericay or Brentwood or Rayleigh or Dartford or Gillingham, why can't you get one in Thurrock? That's my question. I don't understand it.
I think that's a fair question. Obviously, in relation to the walk-in queues issue, I'll take your experience back to the team around how that queue is not serving your experience. I can't comment on areas outside of MSC, but what I will do is to bring back to you the position in Thurrock as part of the MSC, how it relates to the rest of the MSC position. On any day when you go onto the system, I don't use SwiftQueue, so I don't want to comment on matters of which I'm not fully briefed. But what I can do is come back to you with a clearer picture of how the service provision in Thurrock relates to the service provision across the rest of the area that these areas provide. If that's reasonable, Councillor Spate, but just to address your concern and to encourage the team to provide more detail.
It's very reasonable, but with the greatest of respect, I mentioned Rayleigh, Southend, Billericay, Basildon, Wickford. They're all in your patch.
Yeah, as I said, I can bring back how access comparison for those areas.
Councillor Polly.
Thank you. I'm sorry to say that these blood test appointments were brought up at previous HOSC meetings, and part of that was for the cancer patients as well, the delays and their availabilities. I gave an example of a cancer patient that I knew where the services at Allsit had just been taken away on a Saturday morning. The walk-in service was... You've said that they're available at Allsit, but the caveat with that is subject to staffing. They're not guaranteed. So that is a big concern of mine, because it's, if you've got enough people, there will be there, but if there's not enough people, they won't be there, which doesn't really help our residents. The other thing that, as Councillor Spates alluded to, he lives in one half of the borough, in the east, I live in the west. When I put in my postcode for SwiftQueue, I don't even, last 2 times that I've needed a blood test, I don't even get offered an appointment in Thurrock at all, not at the community hospital, not at Allsit, not at Ockenden Health Service, Health Centre. I get offered Queen's Hospital. I get offered, as Councillor Spates said, Dartford. The thing about that, they're outside of the PCNs. So then you have more problems about those results getting back to a Thurrock GP, because they're not on the same network. So I actually have a resident in Ockenden that was offered an appointment at Queen's Hospital, went there for their appointment, and then that took 12 weeks for that blood test to end up back at their GPs. So the SwiftQueue, and that is something that we have raised before, that's not a new thing to be saying tonight. Further to that, I raised it as I mentioned, as a governor's question, and following some comments between Chair and I, there were some detailed questions about how many actual appointments are there at South Ockenden and Allsit provided each day, not just walking, but overall how many, this type of, and there was quite, I think in total I asked 3 specific questions, and I should have had a 10-day answer to that. That was mid-September, and I still, as a governor, have not had responses to those questions. So I'm very we're getting into the IMC scenario. We ask questions, we raise the points, we're expecting responses, and at each meeting we're being told, "Oh, look, we'll get you those for the next meeting, the next meeting." In the meantime, you know, as we've just spoke about earlier, this time of year, there will be increased demand because of people's, ill health and things like that. There will be increased referrals from GPs and that for blood tests, see if, to check if the CRP levels are up and things like that. So it's another area where we as HOSCA are asking questions and we don't seem to be getting the answers. And the fact that the same as Health Watch had the issue about raising questions and not getting responses, it took this committee to actually get to unblock that channel of dialogue. I just thought we've been quite specific. I know, and I can do that outside of this meeting, Fiona. I can get Evie Lamb as well, don't you? So we can get that information to you. But from a two-pronged approach, as a NED governor and as a vice chair of HOSC, no responses to our questions, and I'm disappointed with that. To be truthful, I am.
So, in order to avoid bringing a report again next time that doesn't fully answer the questions, Councillor Polly, if you're happy, I will follow up on those matters that you've raised, not at the next meeting, but in advance. And then if there are further queries, perhaps we can follow up in between meetings and ensure that what comes to HOSC next time is more satisfactory to the committee in relation to where we are with phlebotomy services for Thurrock.
Okay, so I think what we're really saying, Fiona, this is really a matter of urgency. And it does feel, though it may not be, but it feels to us a little bit flippant that the people of Thurrock in particular are waiting up to 8 weeks or more to get an appointment. That's not cost effective to health because you're not dealing with people's health issues quick enough, which I'm sure is actually going to cost health more money in the long term. And as Councillor Spate has suggested, that there are areas locally where you can get same-day appointments, and it doesn't kind of add up. I get the fact there's a bigger demand, but we've moved very quickly from a service that was fairly well responsive 18 months ago to one that's not now. So can I ask that the Trust deal with this as a matter of urgency? Councillor Piccolo.
Yes, sorry, Chair. Just a quick observation, really, and also I had a blood test at Allsit about 3 weeks ago. For whatever reason, there was only 3 phlebotomists on. One of them was actually coming out and working reception. Like there'd been no one in reception for 20 minutes or so, and then one of the nurses that would be doing the blood test came out and checked everybody in. Now that's got to be ludicrous that someone that could be doing that. All right, everybody probably got C on that, would have got seen on that day probably. They wouldn't have turned anybody away because they were running late with appointments. But can you imagine the frustration for the patients that are sitting there and waiting possibly half hour after their appointment time to see one of the nurses that's meant to be doing the blood test coming out and running reception? It doesn't give a good look. Sorry about that, Chair, but I hope you can indulge me.
Thank you. So hopefully we'll hear from you very shortly, Fiona, but in the meantime, can you keep us informed? Because what I'm really looking for is that action plan of responding quickly to the situation in Thurrock. Okay, if agreeable, could I move on to item 10, which is the work plan? Okay. Have you had Councillor Spate?
Yeah, I've got an issue, and it might possibly fit under the EPUT update that's already scheduled for January, but it may be an issue on its own. And I'm not speaking on behalf of, but I'm speaking having spoken to a number of members of the local LGBT community in Thurrock, who are very concerned that a number of the support services for that community are really not being well run. Specifically, they're, for example, and it's not an Essex problem or a Thurrock problem per se, but for example, the Gender Identity Development Service, which is more or less collapsed nationally now, you can't, we've got children in Thurrock aged 15, 16, 17 who have just been chucked out of that system. They've literally been told they were waiting for appointments, and they have been told it's all changed now, you've now got to wait another 2 years. Now, it's just not acceptable in this modern day and age for that to happen. I appreciate, I think it's Tavistock who run it on behalf of the NHS, which is, I think it's farmed out locally. I'm not an expert in how it actually all works, but I do know there are a number of distressed families who have been waiting and hoping and worrying and have been chronically let down by this. And I know there are other support services within the LGBT community that they feel that they've been shoved to the back of the queue for one reason or another. As I say, in terms of the issue on GIDS, this is a severe issue. Let's make no bones about it. As a parent, you've got a child suffering those issues. You worry whether that child is going to self-harm, whether they're going to go even worse. It's a huge family concern. It's very, very difficult. And the sense of desolation when you suddenly find that you're waiting for something to happen and then it's just taken away from you for those young people is terrible. It really is awful. I mean, it can be argued it's a small issue in the context of some of the massive things that we've talked about today, but I promise you it's not a small issue for those people who are affected. Whether we look at whether there are local solutions within EPUT, I don't know. Whether there are ways that the trust wider locally can help, whether there are other support services within the volunteer sector that can help, I don't know. But I'd like to get some help and advice from those support agencies that could help us and possibly bring a report to this meeting and probably go out and talk on a more informed basis to members of the LGBT community who we could invite to share their concerns with us on a more formal basis. But I really think it is problematic. And as I say, that it was interesting when Fiona mentioned that they were coming back with issues around mental health, and Georgette said what a great service there was there, and I've had some experience of it, sort of some good, some bad, in recent months, and I didn't know whether there was a synergy there that it could fit into our work programme. If not, I'd like to ask if we can find a slot in its own right, please.
Thank you, Councillor Spate. That's something I will look at trying to fit into March.
Chair, I'm just trying to work out who would be the best person to produce the report, and I'm assuming, and maybe my NHS colleagues can help me, it's an NHS specialist commissioning function. So maybe we invite someone from the NHS specialist commissioning team to bring something back.
Sorry, I do think we do have a fairly vibrant and active. There are some people who may have some local input above and just beyond the silly person like me, but who they might be more informed. You know, I'm just getting a feedback. This is terrible. We've got some very distressed people. You know, is there anything you can do about it? But I mean, I can lead on that and try and find some more information if it helps, and liaise with you, Ian.
In terms of the community element, we can certainly pick that up through Natalie Smith's team, and I know she has links into those networks. So yeah, I'm very happy to let's have a conversation outside this meeting.
Councillor Polly.
Thank you, Chair. And I don't know whether it be input or e-put or where it comes from, but along the lines that Councillor Spate has just mentioned, neurodivergence, the waiting times for children awaiting ADHD, autism, neurodivergent diagnosis is 2 years plus. And that gives me a great concern, because there are, you know, we can't look at the EHCPs and you've got, you know, children that are in an education system that might not be getting the right support at a very important time of their life, and it might have to wait until the new municipal year, but I definitely think that is something. Ian, please.
I don't wish to decry the issue. I think it's probably a matter for Children's Overview and Scrutiny Committee there rather than the HOSC, particularly if you're looking into SEND stuff. So you might want to have a conversation with Councillor Carter.
There's also adult ADHD, and I do, and there is some age discrimination. But yeah, sure, I'll have a conversation with Councillor Carter. Okay, thank you. But effectively, it is a GP that's again the gatekeepers to the referral services, lack of psychologists to be able to do the assessments. Thank you.
Okay, so I just want to come back to you, Councillor Spate, and we'll see what we can do in terms of the work plan. I'll discuss it with Ian. Okay, so I will come back and do that to you very shortly. Right, we do have quite a hefty work plan now, and so I'm requesting at the next meeting that we actually start at 6:30, but may have a comfort break to try and get through the work plan. Is that agreeable by all? Yes. Okay. That being the case, the next meeting, I think it's on the 11th of January, and I'll call this meeting to a close at, I think I'm just about right on time, 9:15. Thank you very much.